Good afternoon, everyone. We're going to give everyone a few minutes to funnel into the room, and then we're going to get started. Thank you for joining us for Black Maternal Health Week. We're excited to tell you what we've got going on. All right, we're going to get started. Hello and welcome to the Perinatal Health Equity's third annual celebration of Black Maternal Health Week. It is our pleasure to bring you our event this year as the New Jersey movement partner for the Black Mamas Matter Alliance. The theme this year is Building for Liberation, Centering Black Mamas, Black Families, and Black Systems of Care. And I'm going to begin with a short presentation about us as an organization, the state of Black maternal health in New Jersey, and then we will have our first speaker come on, Brianna Henderson, who will be talking about her experience as a peripartum cardiomyopathy survivor. Okay, so if you are unfamiliar with Black Maternal Health Week, this is really kind of like the Cliff Notes. There's a lot more detail on the Black Mamas Matter Alliance website, so I recommend going there if you want to learn a little bit more. But this is now in its fifth year. So it was established by the Black Mamas Matter Alliance in 2018 and has continued to grow every year. As I'm sure you've seen, there are tons of events now, not just locally, but across the country that are honoring Black Maternal Health Week in some capacity. As I mentioned, the theme for this year is Building for Liberation, Centering Black Mamas, Black Families, and Black Systems of Care. And I want to just highlight that theme is important because often what happens is we talk about Black maternal mortality and we don't talk about the good things that happen with Black pregnancies. We don't center our mamas, we don't center the good things. And so we've got to be very careful with that narrative of only highlighting the bad. It creates fear in our community. And although it's important for us to talk about it, we need to mention it, but it can't be the only thing we focus on. We've got to focus on solutions and things that are really good about Black pregnancy and Black birth. So I want to give a thank you to our sponsors. This event is being brought to you free of charge from the Robert Wood Johnson Foundation and the March of Dimes. So I want to thank them for their support. And I want to just give a quick rundown of the event. I will put in the chat in a little bit the link to our website, but if you are interested in attending events, I'm sorry, if someone could just put themselves on mute, please. If you are interested in attending any of the events that we have this week, you can get the full scope of everything that's on our website. So today is our kickoff. And as I mentioned, we'll have Brianna Henderson speaking about her experience as a peripartum cardiomyopathy survivor. And then later on, you'll have an introduction to a co-sponsored event that is being done by our group, Sistahs Who Breastfeed, and the Chocolate Milk Cafe, and a few of our local mamas and our staff who will be talking about the importance of breastfeeding, chest feeding, and peer support in Black mamas. Day 2, we have 2 days of policy because policy is incredibly important. We will kick off the event with Senator Teresa Ruiz. Just announced we will also have Assemblywoman McKnight joining us. So I have to just make a formal announcement that she will be joining us for this event as well. We have Lexi White, who will be talking about basically policy 101, what you need to know as someone, as a consumer of policy, as an advocate for Black mamas. And she is from the National Black Women's Reproductive Justice Agenda. And then we will have Health Connect One, who will be talking about the newly formed New Jersey Doula Collective and the importance of accepting Medicaid as a doula and kind of that process of getting started with billing. The following day, we continue with policy. We have Luann Foster, who will be talking about stillbirth prevention and count the kicks. New Jersey Medicaid expansion, which is so important that our state just got that passed. But what does that mean and how is it going to impact care? So we're going to have Michelle and her team who will be presenting on that. The Medicaid expansion, and then also just a introduction of policy in New Jersey. So what's happening in New Jersey with policy, and Ellen Mon and Jill Wadnick will be giving those presentations. On the 14th, we have My Black Beautiful Birth. It's going to be a combination of experiences from different mamas delivering in the birth center, delivering in at home, midwives, doulas, and we have a special celebrity guest, Kadeen Ellis. She is from, you may know her from a couple of different shows, but she has a widely received podcast called Deadass that she does with her husband, which is amazing. So we're excited to have her and her sister, Sakari, who also happens to be a registered nurse entering into the women's health birth space. So they will be joining us for that event. Kadeen recently had a home birth, and she'll be sharing her experience through that. On the 15th, we have Fathers of the Movement, and this is a very important event for us because we will be talking about two fathers who are local to us, Aaron and Robert, who recently lost both of their wives within the last year. This event is offered free of charge, but we are asking for donations, as those donations are going to the fathers of this event. Aaron is raising 4 children by himself, and Robert is raising 5 children by himself. And so any funds that we raise for this event will be going to those families. And we also have Amari Maynard, who was a partner of Shamani Gibson in New York. She was a recent loss, as well as Bruce McIntyre, and they have both done amazing advocacy work in changing these narratives to stop these things from happening. So I think it's important to get the father's perspective. And then lastly, we will have the nurses station. And although this is welcome for anyone to attend, we have advertised it specifically to nurses because we want to make sure that because we know most of these deaths are preventable, that we are talking about the roots of where they're coming from and what we can do both as nurses in the community and in the hospital to early identify where risk factors might be, what implicit bias looks like, talking about disparities in healthcare and how we can make a difference as nurses. But as I mentioned, it's welcome for anyone who has an interest in the topics. And we chose not to have an event on the 17th because it's Easter Sunday, but we will continue to offer events throughout the year. So I want to do a quick introduction to who we are as an organization. As I mentioned, we are the Perinatal Health Equity Initiative. We used to be Foundation, but we recently changed our name. And so now I'm going to hand it over to our staff to introduce themselves. So I'm going to just stop sharing briefly to give them the floor. And I am going to begin with Zakaya.
Thank you. So my name is Zakaya Stewart. I am a full-time public health graduate student at Montclair State University. I'm currently working with PHEI as a program development specialist, and it's really nice to meet you all.
Thank you. Asia, I'm going to let you go next.
Hi, everyone. My name is Asia Good. I have a bachelor's in health science. I'm also a certified breastfeeding specialist here at the organization. Also a mother of 2, got the whole breastfeeding experience while working and being in school. So in terms of maternal health, experience it all.
Awesome. Latoya.
Good afternoon, everyone. My name is Latoya McKell. I lost my train of thought. So let me start over. I am a peer breastfeeding counselor with the organization. I am a mom of two. I have a background in political science and pre-law. I also experienced breastfeeding, being a working mom, two kids back to back. So that's where I think my influence comes in at. So nice to meet you all.
Thank you, Latoya. And last but not least, Romy. Romy was actually our first hire. So, hey, Romy.
Good afternoon. Thanks for having me. So my name is Romy Beaujoin. I am the perinatal community health worker for PHEI, as well as one of your certified breastfeeding specialists. I actually was super excited joining on last year in January because it was like my first time having a job that I knew was in line with the work that I do. So I'm also a doula and I have a background as an IVF embryologist. So I've kind of been in this maternal health world for quite some time. And I'm also a mom of a 2-year-old boy, which is the reason why I decided to become a certified breastfeeding specialist, because I truly feel that as Black women, we need support, and I wanted women to feel seen and heard. So that's why I decided to join on with PHEI, and I was super excited to do the work that we do. So nice to see you guys, and I hope you guys enjoy the week of event that we have for you today.
Thank you. So I wanted to lead with staff introductions because I could do none of this without them, and they know that. I lean heavy on them. They are an amazing team. Grateful for them every day. So wanted to start with thanking them. This is the mission for our organization. And so we consider ourselves to be a grassroots community organization, and we are dedicated to actively working towards eliminating disparities in Black infant and maternal health through our 5 pillars, which include advocacy, education, community engagement, research, collaboration, and direct clinical support. Our vision is basically a space where we no longer have these disparities. Although I love celebrating Black Maternal Health Week, I would love if we didn't always have to have it rooted in death and disparities and bad outcomes. I would love for us to get to a space where there's an equal playing field. And although we know we can't ever eliminate maternal morbidity completely, because there are certain situations that are beyond control, but I would really love for us to be in a space where it's no longer Black women that are leading that narrative in poor outcomes. And just a little history in our foundation, we are a 501c3 nonprofit organization. I founded the organization in 2018 due to a series of maternal and newborn deaths in New Jersey. And this was my own personal purview of being in different mommy groups and seeing these deaths being reported. And as a nurse, these are never events. We're told that a maternal death is a sentinel event, should never happen. And when I started seeing multiple stories being shared of mothers who died in childbirth, I really began to recognize that something was going on in our state that needed attention. And so I shifted from being a business. I had started out as a private practice lactation consultant, and really shifted to really move into a nonprofit model to really make the change that I felt was necessary for our state. Just a little bit about me as the founder. I am a registered nurse. I've been a registered nurse for about 19 years now. I'm also an IBCLC. I am also assistant professor of nursing at Montclair State University. So I wear many hats. I'm very busy. I'm also a mother of 4. And so those are all my driving factors that have led me to this work. These are our values. I'm not going to spend a ton of time on them, but I do want to just highlight that Black does not equate low income. And as we talk about these disparities, we often tend to focus on low income, low resource communities. And although they are hit harder than others, we know that there is no income protection or no education protection for Black women. And so as we talk about making change, we need to make sure we're including all Black women and not just siloing or siphoning out low income Black women, because it affects all of us, myself included. A little bit about our work. Black Breastfeeding Week has been an event we've done in partnership with other organizations for since 2018 is when we did our first one. We have since moved on and done it on our own. But it is a way to honor and celebrate Black breastfeeding. We know there are disparities there as well, which are really important. We have a breastfeeding support group called Sistahs Who Breastfeed. And this is one of our outdoor events. As the weather warms up, we tend to move outside, especially during COVID, but it is a safe space for Black women to talk about their breastfeeding experiences, which we know are different and unique for Black women. We meet online and virtually. We have different events. Like recently we went to the zoo. We've got another event coming up soon. And so we recommend that if you have families who are needing support, you have our group, and we also have Chocolate Milk Cafe, and you will hear from them a little bit later. But these are the two peer-led, Black-led support groups in the state. Our programming, so other things that we do, we have community health workers, and you got to meet them. They provide support for mothers during their pregnancy and after delivery. We have a Then Came Baby advocacy series, and this is designed as a 4 or 5-part education series that helps to prep families for that transition to childbirth. So we talk about how to advocate for yourself in the birth space, what are your rights, what happens to your body during pregnancy, birth, postpartum, how to care for your baby, how to breastfeed. So it's a really good educational series. We've partnered with Southward Promise Neighborhood to offer this opportunity and are looking to expand it. We also provide a significant amount of breastfeeding education and training. We have access to blood pressure cuffs, which we think are really important due to cardiovascular health being one of the leading causes of maternal death in our state. Tanita's Village is where we give out necessities for mom and baby supplies. So if a mom needs a car seat, if they need clothing, if they need formula, we're able to provide those resources. We do community baby showers, and we have, of course, more things that will be coming in the future. And I want to announce one of the things we are most proud of is our Breastfeeding Clinic. We are going to be opening this in the summer of this year. We are grateful for a partnership with Dr. Thomas of Park Avenue Pediatrics and Associates. She has given us space in her office to be able to provide this benefit to families with little to no out-of-pocket expense, and we will be able to accept insurance. All right, so moving on into the state of Black maternal health in New Jersey. So this statistic has been kind of all over the place. So I think most of us know that New Jersey is not a great place to give birth for any woman. So we rank 47th in the country in maternal child health outcomes, and we have one of the widest gaps in the country in disparities. As of 2016, our top causes of pregnancy-related deaths, number 1 is postpartum hemorrhage, 2, cardiovascular disease, infection, preeclampsia, and cardiomyopathy, which is why we are grateful to have Brianna Henderson here to talk about cardiomyopathy today. Here are our disparities. And so I think the visual is helpful to see kind of where we are. We're continuing to not improve the situation. Unfortunately, each year you can see our statistics tend to get worse. And this is the most recent data from the CDC. And you can see this is not New Jersey specific, this is across the country. And I'm waiting to see where we lie in New Jersey. That data has not been released as of yet, but I can imagine if we did this bad as a country, that we are probably just as bad here in New Jersey, and we have a lot of work to do. Of those deaths, Black women are 7.6 times more likely to die of a pregnancy-related complication than white women. As I mentioned, education and income are not protective factors for Black women. It is not because Black women are sicker or entering their pregnancies unhealthy. It is racism is the short answer. And so we know that white women who enter their pregnancies with the same conditions, high-risk conditions, do not die as a result of those conditions. And so there are other factors that are part of that. So we've got to definitely move away from the blame the patient narrative and really look at the system and how it's impacting care. We know that in New Jersey, postpartum discharge checkups are lower. And so we have to look at where are some gaps that we can be improving there. As I mentioned, we don't want to leave out middle and upper income Black women from strategic planning as we work to eliminate these disparities. They are just as much at risk as anyone else. If anyone wants to check it out, Serena did very detailed share her story. And it's not new, it's been shared before, but she shared it in her own words about what her experience was like having to advocate for herself. And so someone who has celebrity and money, even her, experienced racism in her care. So we have to keep that in mind as we work towards making this change. What are some solutions? I have blended here the Nurture New Jersey strategic plan and the Black Mamas Matter Alliance strategic plan. I think that we have to elevate where Black women are leading the charge on this and make sure that their work is being cited and recognized. That's actually one of the themes for this year, is making sure that we have Black women centered at the forefront of this movement. And so we have to make sure that there's a process of combining those efforts. And so if you have not looked at them, they're available on each of their respective websites. I recommend that you download them and read them, but they are a plan. And so plans are not good without implementation. So we have to work on identifying where we can make some change within those plans. And as far as what can you do, there's a toolkit that is going to be released later on today, which you can use to share. There are social media graphics that'll be within there to help elevate on your own personal social media or organizational social medias about Black Maternal Health Week and what we're doing here locally. As I mentioned, we are fundraising for this event. We have set a fundraising goal of $25,000. And so if you would love to invest in our organization, the link has been provided. I will drop it in the chat a little bit later. You can also choose to start a Sisters Who Breastfeed chapter in your community. We will provide all the technical assistance of getting that up and running for you. So if you are interested in doing that, that's another way that you can help make a difference in your own communities. We are always looking for more partners. So if you would like to partner with us and you are a like-minded organization, please reach out to us. We'd be happy to explore that. And then lastly, train with us. We are going to be releasing some various training opportunities over the course of the year. So we encourage you to sign up for our newsletters if you're not currently getting them so that you get updates. I do want to mention the importance of breaking down silos. And so we will be having our first annual conference this October. I don't have a date for it yet. I'm still working out the kinks, but please save us sometime in October for our conference. Really want to look at organizations in New Jersey who are making a difference in changing maternal child health outcomes. And then across the country, what are some things that are working from a public health perspective to really make a difference? And so we hope that you can join us for our first annual conference. Thank you for your time. And with that, I will move on to introduce our next speaker. We have the Q&A boxes open. If you have questions while you are listening to your presentations, please feel free to drop them into the Q&A. Myself or one of our staff members will respond to your questions in the chat. Let me just get Brianna up here. Okay, give me 1 second to get Brianna's bio in front of me. My computer is freezing. Okay. So Brianna Henderson is the founder and CEO of Let's Talk PPCM, a patient advocate, certified patient family partner, and doula. She is also a wife and mother of 2 children. She was deeply inspired to provide comprehensive prenatal and preventative education after serving a missed diagnosis during her pregnancy and postpartum season. After recovering from her acute health condition and learning what took her sister's life, Brianna dedicates her life to ensuring that mothers and families are informed during their perinatal year. She fulfills the Heart's mission through professional doula support and her nonprofit organization. And with that, it's my honor to introduce Brianna Henderson. Thank you and welcome.
Hi, everybody. Thank you all so much for having me today. It is a pleasure to be able to always bring awareness to peripartum cardiomyopathy. And peripartum cardiomyopathy is an often unrecognized and misdiagnosed form of heart failure that's found in pregnancy. And as a result, the heart becomes enlarged and the blood can no longer pump through the rest of the body. So in 2013, studies had showed that 1 in 1,300 women develop peripartum cardiomyopathy in the United States every year. Okay, again, this is in 2013. So of course now we're in 2022. So I'm pretty sure that data has, changed drastically. And we're still waiting on continuous updates. As a result, many women die from not being properly diagnosed in time. We now know that the sooner PPCM is detected, the higher the mother's chance of making a full recovery. PPCM is one of the leading causes of maternal mortality in the US, okay? And this is something that we didn't really know of until we kind of got involved into the advocacy work. A simple blood test could actually save new mothers, and this blood test is called the BNP blood test, and what it does is measure the levels of a protein called BNP that is made by the heart and the blood vessels. So BNP levels are higher than normal when a woman has heart failure. Okay, our 501c3 nonprofit organization, Let's Talk PPCM, has created a PPCM screening exam that can increase the chances of sooner detection in women with unknown PPCM genetics. So PPCM is a genetic disorder that women don't even know that they're carrying. Okay, so data is collected for medical and informational purposes on our behalf. We do provide a training or a special training for the screening exam as well. And everyone can learn about that on our site, let's talk ppcm.org -ppcm screening. And also a BNP test is recommended for moms with high blood pressure, if they've ever experienced with high blood pressure, preeclampsia, if they've ever been diagnosed with preeclampsia, multiple births. So just having multiple births, because it could happen on either the first child or it could happen on the fifth child. It could happen on the ninth child. I mean, it just doesn't matter which child. It could happen as long as, like, if a mother experienced multiple births. Heart murmurs, any mom that has been diagnosed with a heart murmur, ever had one. And I know hypermissive, that's a disease or some type of vomiting illness that women is called HG. So we have found out that it's some sort of link that can be there with HG as well for PPCM or a risk factor. Fertility treatments. So we found out that fertility treatments can be linked to having PPCM as well. And then also just a family history of heart disease. All right, so we do offer this a life-saving 25-minute service where mom is greeted by an actual doula, which is myself, and then our FNP, which is our family nurse practitioner. And we just kind of screen the mother of any type of, a certain questionnaire that we have. And then we also go into getting a blood draw and then taking that blood draw and going to get it tested just to let the mother know, or to be at peace to know that she, is not candidate or at risk for PPCM. Okay, now since PPCM is considered rare, doctors aren't watching for it. Okay, so which is, that means that the actual number of the cases may be higher than what we know. Okay, Let's Talk PPCM. We do accept tax deductible donations to offer free BNP blood tests and postpartum exams for moms who develop risk factors for peripartum cardiomyopathy. And we also just had our awareness week approved by the Texas governor to have our own PPCM awareness week, May 10th through the 17th. So we're excited to celebrate that. So now that we mentioned all that good stuff, what I did want to mention today is about how I even got involved in this work. And how I got involved in this work is, okay, around the time I was expecting my second child, and Me and my husband, we was definitely excited. It wasn't nothing out of the ordinary or anything that, could go wrong. I wasn't at risk for anything. I had a normal first pregnancy. So I just assumed that everything would be good and gravy for the next pregnancy. Um, but during this pregnancy, I did experience more prolonged morning sickness. Like the morning sickness lasted all day. It wasn't just no morning sickness that was in the morning, it would last throughout the day. I remember complaining about it to my obstetrician. Like I probably got to like the 5th month. I was like, oh my goodness, I'm still vomiting. And I didn't do that the first time. She was like, oh, well, it's just, that's, probably normal because it's multiple pregnancies. It's different, that brings on different, reactions. And so, of course, I didn't think anything of that. So when we got to about 36 weeks, and I'm starting to go through my prenatal checks weekly, I had noticed there was a flutter or something in my heart. It was something that was, it was alarming to me. I could feel it. It felt like it was bubbles or something in my heart. And it wasn't a constant bubble feeling. It was like kind of just, it let me know that it's there and then it'll go away. So I did bring that up to my 36 week visit. And I remember, her checking the baby's heart rate and everything. And I said, I know you don't normally do this, but if you can, I said, could you, check my heart for me? Because I feel like, something weird going on. And so she thought it was a little weird. I could tell because, by her facial expression, but she listened to me. She was like, yeah, I'll check your heart. And I was like, thank you. So she did. And she said she heard a murmur. She said it was a harmless murmur. So she was like, this murmur, it'll go away after the birth. I wouldn't worry too much about it, and she sent me on my way. And so I didn't worry anymore about it. So come to time for labor, I end up going into a severe hemorrhage 10 hours after birth. Uh, what happened in between that 10 hours, I wasn't really educated on what was happening to me and what was going on at that time. During that time, I do remember, her taking at least 30 minutes to remove my placenta. I know that did not happen the first time. So I did not know what what was going on this time, but I did ask her, because I felt like it was taking too long and I couldn't hold my baby while she was, trying to get me set up and everything, trying to remove the placenta. And, by the time she had it removed, I was relieved. I didn't think anything else of it. I was like, okay, everything is great. Oh my goodness, but no, 10 hours later, I end up having like a lot of blood started filling the pad. So I would go and change the pad. I changed at least 5 within 1 hour. I did not know that this was not normal at that moment. I wasn't told to be aware or maybe look out for possible signs of hemorrhage or anything like that, even though it took 30 minutes and stuff was kind of doing differently around this time for my pregnancy. And even though, me and my obstetrician, we had a connection going on. So I was like, well, I trust her. Everything is fine, but yeah. So I went into that hemorrhage. It took 5 hours for them to stop the bleeding. They, came very close to having to rip out my uterus because they almost couldn't see where the bleeding was coming from. So that part was just scary in itself. And, it took the anesthesiologist, after they woke me up and everything, he came and let me know pretty much everything that had happened to me. And everything was kind of just moving a lot fast during that week. They did readmit me in the hospital just to be able to monitor the bleeding and everything. And things started calming down. They readmitted my daughter as well because it was about, time for us to check out, I think around that next day. So they went ahead and kept both of us. And after the actual last day before we got discharged, I had asked my obstetrician because she had came back to visit me for that last time to make sure, everything looked good. And I asked her, I said, I know this is not, normal. I said, but I just want to know if my heart is okay from going through that, because I had just, I went through the flutter. So it's like, well, I just want to make sure my heart is fine. And so she was like, okay, she was like, yeah, that's fine. We'll do that. I mind you, this is something she don't normally do, but we had, I felt like we had a good enough connection where like, I'm just trying to make sure I'm okay. And so she was, okay with that. And so she had them bring up this echocardiogram on the L&D floor, and they checked my heart. And so by the time it was time to get discharged, she came in, she let me know, hey, was just kind of like yeah, the cough was kind of like a cold, I would say, or maybe a flu-like symptom, I thought. And then I have bad allergies as well, so I just kind of linked everything up to that. Um, but what happened was I was I was slowly coming down with whatever it was, and I think two weeks passed, 4 weeks had passed, all the way up until 6 weeks passed. So at 6 weeks postpartum, here I am. I'm about to get ready to, have my 6 week checkup, and everything was I thought was going fine up until this point. Besides me having this irritating cough and kind of gaining weight a little bit, which I thought was healthy weight. Thought it was, me gaining weight from the actual pregnancy, and I didn't think anything of it. Other than that actual year, it was around Christmas time. So Christmas Day, because I had her November 8th of 2016, and this was December 25th of 2016. And so I had went to my gathering, and my dad noticed that I didn't look good. He did let me know that I didn't look good. I looked very sick, and so he was concerned. So he ended up giving me some sinus pills, to take while I was there. I did take them. I didn't feel any relief, of course, but you have to take medicine over and over again to kind of feel some type of relief, right? So that's what I was just gonna wait on. That night when we got home, I could barely make it to the door. My husband had to actually kind of help me get into the house. And once I did, from the parking lot to getting in the door, I literally had to just fall out on our couch. I felt like I was so out of breath. I told him, I said, oh my goodness, it felt like I just ran, to the door. Literally, I just walked. I only walked to the door, but it felt like I was running. And so after I had caught my breath on the couch, I pretty much started getting ourselves ready for bed that night. I remember pumping. I made a lot of milk. So I was pumping that night. I pumped at least every 2 to 3 hours. And around, I think about 2 in the morning, I would say, of the next day on the 26th of December, I asked my husband to come in there to listen to my heart, because I told him, I said, it sounds like it's beating so fast, and he listened and he said, yeah, he said it's beating fast, and I was like, I said, well, maybe it's because I'm pumping. I was just trying to make, something. I didn't know that something could be going on. I just thought that, um, hey, my heart beating fast because I'm pumping or something. Like I just made it up something to calm myself. I didn't want to think negative. And my husband, he's not a negative thinker either, so he didn't want to think anything bad. We were just like, oh, it's from the baby, or having baby is fine. Anyways, I left it alone. It was time for me to go ahead and lay down. I laid down, and I literally felt like I was underwater. Like I couldn't breathe at all. And if anyone knows how it feels to hold your breath underwater when you're under there too long, that's exactly how I felt with just laying back just a little bit. So I literally had to pop back up just to sit up till I could breathe. So at this point, I'm like, oh yeah, this is a bad sinus infection. Oh my goodness, it's really bad. I can't even breathe when I'm laying down, And so I just leaned over because my husband, he was asleep. He had to work that morning, so I left him alone. Baby girl, I was, having her up and down, but I was still able to, take care of her as far as until like a couple of hours that actual same day. I couldn't really hold her because I was out of breath. So my husband had to kind of just help me with that because it was getting like bad. I was, slipping away slowly. And I remember texting my dad, and I let him know that I couldn't breathe, while laying down. I didn't get no sleep. And I because he knew I was sick that day before. So he was like, Bree, that doesn't sound normal. You need to go to the hospital. It sounds like it could be pneumonia or bronchitis. And I was like, I said, I go to the doctor, Thursday. Here it is, Monday. I said, I go to the doctor Thursday, for my PP exam. I'll be fine until then. I just let her know. And he was like, no, I don't think you need to wait, And so my dad being him, he ended up coming to get me. We was able to, I told my husband, go ahead and go to work that morning. And my mother-in-law was able to keep baby girl. And then our son, he was at his grandmother's as well. So they gave me the time to be able to try to at least find out about myself, to check on my health and what was going on with me, since normally everything is about the baby. Okay, so once we got there, they did notice that my vital signs were abnormal. They saw my oxygen levels was at an 82 and dropping. My blood pressure was high. I know it was at least 152 over I think 93, I believe. So it was like it was not normal for me, and here I am, I was 23 at that time, and 2 months postpartum. So at this point, they didn't know that I had a baby. The only thing they did know is I was shortest of breath. So that's what they marked me down as. So since I was shortness of breath, they said that, oh, well, we take this, seriously when people come in shortness of breath, but we're going to have you wait because we're, short of staff, and we have a lot of, people waiting to get x-rays and CTs. And so I'm like, okay, I'm out of breath, but I'm like, okay, so we finally get in line to get an x-ray, me and my dad, because we're sitting there, we're just waiting. And after we do the x-ray, they said they had to send us back into the waiting room. So we had to go back into the waiting room for 2 hours. And we just waited there. They said they had to wait on a room. So finally they got us a room. We was able to go back. And at this time, I think it took about probably 30 minutes for the doctor to actually come in. He had the chart already. They had already did the x-rays, and he was like, look, he said, you got fluid, over, we see fluid that's covering your heart and your lungs. That explains why you can't breathe. He said your heart, was also enlarged, And so me and my dad was looking at each other. We was like, what? Like we just last heard this information 3 years ago when, my sister had passed away. And so the doctor, was like, yeah, I see in your file, your sister died of a cardiac arrest. And, and my dad was like, yeah, and she died, she had a baby, and my daughter, my other daughter, she just had a baby, like that. And so, the doctor was like, oh, you just had a baby. So the doctor wasn't even aware that I had a baby. I didn't know that you had to actually tell them that. So, yeah, so the doctor found out like that, oh, she just had a baby. So he marked that down in the notes. And from that point, he said that, they had to admit me because, of course, they had to run more testing to see what was going on. And they did. They they sent up a cardiogram. I remember that night. And I told them, I said, I already did this. I said, I did this already. My doctor, my obstetrician said everything looked great. And they was like, well, they want us to do it again. And I was like, okay, so they did. It took 24 hours for me to see a cardiologist. So 24 hours later, after that, then the cardiologist came in and just, I didn't really think anything of it. I didn't think it was going to be anything crucial, serious. I really just thought I was going to get antibiotics and be gone. That's what I was hoping for anyway. I was ready to get back home with my family, so that's what I was thinking about. But he comes in and he says, you're so young. And I'm like, yeah, I know, and I'm on this heart floor. They had me on a cardiac floor because, at this point, they know there's something going on with my heart. And he says that I'm the youngest patient on the floor. So mind you, I'm not thinking about any of that. I'm just thinking about my baby ready to go home. So the next thing he says is, I noticed that you just had a baby, about 2 months ago. And I said, yes, I did, and he said, yeah, and I see in your file, you had a sister that, went into a cardiac arrest. And you know, 3 years ago. And I said, yeah. And he said, did she have a baby? I said, yeah, she did. You know, I said she passed away like 6 months after the birth, you know. And I'm like, here I am 2 months after birth, and I'm in here with shortness of breath, you know. And so he says, you know, yeah. He said, okay. He said, well, there's a condition called peripartum cardiomyopathy. And, you know, he said, I'm going to diagnose your sister with this condition as well as you. He said, I feel like you're suffering from peripartum cardiomyopathy, also known as PPCM. And he explained it to me. And I told him I never heard of that before. Why is that not told to women, or why wasn't that something in a pamphlet or something, you know? And he said that is, you know, rare. It was known as rare. So a lot of doctors probably won't, you know, they can miss it. It's easy for them to miss. So with that being said, I'm, you know, on Google, I'm trying to search, I'm looking at stuff, I'm trying to figure out what is this peripartum cardiomyopathy. I'm like, I never heard of it before, you know. And so as he's telling, you know, me and my dad, he's trying to coach us through things, and we like, well, we know we thinking to ourselves, it's not finna end good. We already been through this. It was a crisis all over again. It was a whole tragedy all over again, you know. But now we had a name for it, you know, because at 3 years prior, we didn't even know what happened to my sister. We just knew that we was going off what they said, and they said that she was what they called it a natural cause, even though she was 27 years old when her heart stopped. But they called it a natural cause, and that's what they ruled her death as. So my cardiologist, you know, being you know, so nice, kind-hearted, the guy that he was, he was able to actually get in my sister's file that she passed from PPCM instead of a natural cause, not knowing exactly what happened. And then that also helps with data along the way as well. So with that, he told me that it was a chance, or I had a 50% chance to survive. And he said, but we was going to do everything that we could to reverse the condition. And so I was like, I said, it can be reversed. You know, I'm asking questions because I'm like, no, I remember, you know, half attacking the nurses, you know, when my sister was in the hospital, not finding out. And they wasn't, you know, I felt like they wasn't trying to find out good enough what was going on with her heart, you know. So here I am now reliving in her shoes, you know, and 10 times now, because now I'm literally living as you know, the treatment and everything. I had to go through everything, the process. And he gives me my treatments. My treatments was cardiac rehab. I had to go to cardiac rehab. And with cardiac rehab, what you're doing is they're trying to strengthen your heart by making you exercise. And oh my goodness, it is very difficult because you're already out of breath as a heart patient, and then they're making you exercise. So that was a difficult process, but I was getting through it. It was hard having actual a support system or support team is, you know, on my end, because I had already had lost my sister and my grandmother, and then I had lost my mother when I was younger. So I didn't really have a strong support system. You know, I really just had the close immediate family that I have, which is my own, and my dad, of course, and uncles, auntie maybe. Other than that, it was a very small support system. So I couldn't get the treatments. I couldn't keep going to the cardiac rehab. So I eventually had to just kind of start doing my own routine at home. That's just what helped me. They did remove me from breastfeeding. I could no longer breastfeed. They told me that because of the medicine that I had to take, I wouldn't be able to breastfeed. And it broke my heart because I just knew that I was going to be, you know, doing this for the long haul. I was very dedicated to milk. I made so much milk. I had a lot of milk. So it was very devastating for them to tell me that I was going to have to draw my milk. And that was because of the medicine. So it wasn't like I could donate it or anything like that. They had to actually help me dry my milk in the hospital because I was in pain. They had me on hydrocodones, tried to get this milk out of me. It took me and two other nurses. We were just sitting there squeezing the milk out. I'm not sure if that's how you're supposed to do it, but that's how it was done for me. Okay. And mind you, they still running tests on my heart I'm on medication at this point. And then they do bring up the life vest. So I end up getting prescribed this life vest. And what the life vest is it's a wearable defibrillator, and they put it on heart patients who done experience heart attacks or strokes or anything that kind of could cause a cardiac arrest. And so the vest is supposed to shock you if you go into a certain rhythm. And so I had to wear that for 7 months. I do remember going through that with my sister. She did have to wear the life vest as well. And unfortunately, when her heart stopped, it didn't bring her back. And so in my case, the life vest was very different. I remember asking the cardiologist, I was like, why it look like that? I said, it didn't look like that when my sister had it. And he was like, oh, well, it's been 3 years. He was like, the treatment process has changed, the medication has changed, and the devices has changed. And I was like, just in 3 years, and I'm like, wow, that sucks, because just 3 years prior, maybe my sister didn't get, the right treatment option that she could have had, because at this point we are now learning that those doctors weren't aware of what PPCM was or peripartum cardiomyopathy. They wasn't even aware that that was a condition. And that was at a larger hospital here in Texas. That was a larger hospital. And here I am at a smaller hospital. My doctor is very familiar with it. He says that he get at least 2 patients a year with it. And they don't know the cause. They didn't know the actual cause. They just know that it was a genetic form that happened in random women, and they don't know the women that carries it until the woman comes in there shortness of breath, swollen, maybe have a heart palpitation, heart murmur, and that's pretty much like the symptoms and she may have a cough, a dry cough, I would say, because the cough it's not phlegm. The only phlegm you would probably get is probably pinkish or reddish, maybe some blood may be in it. And that's just if the more severe that the symptoms get. So like if I would have got checked probably 2 weeks when I had experienced that cough, then maybe I probably would have, known that my heart function was low. So fast forward to now at the organization, what we're doing is trying to create the data that's needed now for the BNP, trying to see if the BNP will be the best, sooner detection that we can use, at least to help mothers rule out, or at least know that, hey, it wouldn't be heart problems or heart complications or anything that they will have to worry about if they experience, the HG or fertility treatments, just the risk factors. They have preeclampsia. That's a common one that everyone pretty much knows about. So if preeclampsia is a risk factor for PPCM, why isn't that told to mothers who've been diagnosed with preeclampsia? It's kind of becoming an issue because I didn't have preeclampsia, and some people be like, oh, because of the medicine or whatever they use during labor. Well, my sister, she went natural. Her birth was very different from mine. And my nephew came out within 3 pushes, and she didn't have the medication that I had. So I couldn't blame it on medicine or something that, was used. It was just something that was unheard of. This condition was just unheard of. They just didn't know to watch out for it. But now we know that the BNP test can actually sooner detect the protein that's needed to let the doctors know, hey, she needs to be reevaluated or get evaluated by a cardiologist, just to rule out any, heart cardiomyopathy signs or, something like that. So with that being said, I end up staying on the life vest for 7 months. I got off the life vest. The medication, fortunately, it was working for me. The difference between that situation was my sister, her body was rejecting the medication. Mind you, this was different medication that they was using, trying to treat it. So three years later, which is now me was dealing with it, that's what they was doing, trying to see what medications would help, my body or would react with my body. And so they did. They let me know that everything was looking good. They had me there for about a week, and then they sent me on home. After those 7 months, my heart function didn't increase to what my doctor wanted it to be, my cardiologist. And so he wanted to go ahead and get an ICD defibrillator implant. So I did have to get an implant. I did not want to get the implant, but it was just one of those things where my heart didn't recover in time. And so I had no choice but to go ahead and get it, which is kind of a good thing. My cardiologist was more so wanted me to get it because of my sister's situation, not knowing exactly which way this was going to go. Mind you, he gave me the 50-50% chance, so he didn't know if it was going to be 50-50% which way. And so with that, I had to literally, I pulled myself together. I didn't want to be in no pity party. I didn't want to be sitting there crying all every day, just, oh my God, I don't know if I'm going to live or not. I really didn't know what to do. So after my last month, I would say at cardiac rehab, the nurses thought that it would be interesting to bring the news on board to get the story out and to air it. And so I was like, what? It was just shocking to me because they was like, well, no, we never, heard of this before. And we definitely need to get awareness out for it. So I was like, okay, and they brought the news in. So I was on NBC5. They came out to the hospital, filmed me exercising, and then, letting people know that this was a condition that women don't know about, but it's happening. And from that point on, I would say that's when I actually stepped into the awareness journey. So it was kind of brought to me or handed over to me, I would say, because at that moment I didn't know what to expect with my life. I would say I was terrified at the same time, but I was also kind of prepared because I remember watching my sister do the things that she had did. So I was also kind of having to go off of what we did with her to kind of help me out as well, and just in my treatment process, I was like, okay, I just know I'm gonna try everything. Let me just try everything, see if it helps, and fortunately, thank God that yes, things started working well for me. My doctor started noticing that my heart was increasing in function. He called it spontaneous. He said it was just a spontaneous recovery. I ended up fully recovering 2 years later after my diagnosis. Your heart function is normally supposed to be 55% to 60%. When he diagnosed me, it was 15 to 20%. I believe my sister's was around 11%. So mine was rapidly dropping and going into that same direction. And had I not went to the hospital when my dad made me, versus me either trying to wait to get to the doctor that Thursday that I was trying to wait because I was like, no, I'm gonna see my obstetrician. The obstetrician wouldn't have been able to help me with a heart problem, So it's just being able to shine a light and bring awareness to peripartum cardiomyopathy because women don't know about the condition. I mean, I didn't even really know about hemorrhaging. So if I don't really know about hemorrhaging, even though I think that's like another common leading cause of death, in pregnancy or postpartum, that is still not something that dawned on me when I was sitting there bleeding out, filling up those pads, so I don't know exactly what kind of would have been the better approach, but I think for me in my case, maybe if birth is taking too long or longer than usual, or something is just different from the first time, or that the second time is just different from that previous pregnancy, I feel that women should be able to ask questions, and then also being assured that they're actually getting the proper answers needed and not just kind of just brushed off. I don't think that's what happened to me. I don't think that it was a racism thing at that time. I don't look at it as that, but I do remember when my obstetrician, when she heard that I was on the cardiac floor, because she had a nurse friend who ended up letting her know, hey, we have one of your patients on the cardiac floor. And she said her heart just, dropped. Well, she said her heart dropped because she was like, oh my goodness, that's Brianna. She was like, Brianna been telling me, she's been worried about her heart. She was like, she's been asking me questions. So she got up on that floor and she just came and hugged me. And, she was just like, I'm so sorry. She was like, I didn't know. And I was like, it's okay. I said, I didn't know either, but I said, now I know why, the Holy Spirit, my intuition telling me, hey, check your heart, but even in that, I would say, even in checking my heart, um, it was still, it still was kind of a almost too late matter, because I didn't, if I wasn't aware to ask her those questions or anything like that when I was getting ready to be discharged to have the echocardiogram, she wouldn't have known to do it. But when she did it, we didn't see no problems. So if we didn't see no problems when I got out the hospital that day, and then 2 weeks later, I started developing certain symptoms of heart failure, and it was just unknowing that I was actually developing these symptoms. But had I probably got a BNP blood test done in that, that time frame, just maybe they would have saw, oh my goodness, her levels, are higher than what they're supposed to be. We need to get her examined, for, cardiologist and see, so that is pretty much what we're trying to do, now. And, we're going into this very dedicated about getting the awareness out that's needed globally. This condition is actually, I think it affects 1 in 300 women in Nigeria and in Haiti as well. So it's a lot of women or a lot of mothers that's going through it in the African American race, and also just the African race period. So we do know that it affects Black moms more so than any other race, which is another reason why we have to, raise our voices and being able to explain and share the information on why it's important to learn about PPCM. A lot of women maybe feel like it's, scary, and it can be. It's definitely a frightening condition, especially when you get hit with it and you didn't even know anything about it. I just wish that I would have known something about it, or I wish my sister, would have known anything about it. Um, and I'm just, trying to, we're coming up with stuff, new stuff every year. So we're trying to figure out, so the project that we do have this year would be the free BNP blood test and the postpartum exams, which is what we're trying to do. And then also with the screening, we do have a screening available on the site. I was explaining that earlier about the Let's Talk. If you go to letstalkppcm.org, and click on PPCM screening, you can find out a little bit more about the screening. And then also with the test, we have a screening exam assessment on there. And for you to actually get involved in that, it's a course that you can take for training. And we have that set up for birth workers to be able to kind of get a wolf of what we're doing. I think it's very important to get something out as far as having a screening, and not just even a screening, but the actual test that itself with the BNP blood test, so people could kind of be more familiar with either hearing that or knowing that they can ask for it. We do have mothers that have asked for the BNP and they do get denied, or they get told, you're not a candidate for heart problems. Why do you need that? They're kind of, not really heard on why they should get the BNP. So we're definitely trying to educate more families about, pretty much how to go about that. And one of the things I would say is definitely having either organizations to be able to help in that field, in that area, because it definitely, we have to bridge the gap. And that's what I'm like so big on, is bridging the gap with that, because I feel like what we're doing now would have saved my sister's life. With is what the passion came from on me trying to do this in the first place, trying to see what could have been done, to save her life. And then not only that, but to prevent me from having to get an ICD implant. We do have mothers that have to get heart transplants. I mean, it's a 19-year-old we have that had to get a heart transplant because she went into heart failure unknowingly because of PPCM. First baby, okay, 19, okay, now, and then we have a 16-year-old, who experienced PPCM. Again, unknown, unheard of. Fortunately, yes, her doctors were aware of the condition in order to diagnose her. So that's another thing that we're also trying to do. So we do work with the healthcare professionals uh, and being able to make sure that they're educated on what to look out for or certain signs to look out for. And then, just also listening, like my obstetrician, just being that listening ear and okay, my patient wants this done. I don't know why, but maybe we should do it. Let's look into it a little more, because she did that, that assured me that, oh, this woman cared about me at that time, at that moment. Um, and she did her best to make sure that I was heard and, me advocating for myself. So I did pretty much everything right, and obviously she knew that I had lost a sister of a cardiac condition. So she kind of understood why I was asking those questions. But for a mom who doesn't have that history, but she can be, the carrier of it if she had the genetics and she doesn't know, and she done became pregnant. And then, later she starts to experience, certain symptoms, maybe she had prolonged morning sickness. Hello, ding, ding. That can be a risk factor for PPCM. So at this point, it's like, okay, for these women, starting off with these women who's, at risk, how are we able to coach them on, hey, this is a condition, because you was diagnosed with HG or because you was diagnosed with preeclampsia, this is a condition called, PPCM that you may need to be aware of. Not saying that it will happen, just something to be aware of because this condition can bring on the cardiomyopathy, and which is the peripartum cardiomyopathy. So that is my presentation for today. I really thank you all for having me, and I hope that we continue to save lives and that this taught you guys something. Thank you.
Thank you so much, Brianna. That your story, wow. I had no idea. Like I know I teach students, nursing students, about kind of the changes that the heart goes through, and I don't think people realize how much work the heart actually does to maintain a pregnancy. Your heart is under a significant amount of stress, and then you add having the potential for another complication to that. It is a recipe for a disaster. You are at your most critical when you are birthing a baby. Although we get something beautiful in the end, I think it's kind of understated how at risk you are just from being pregnant, because if you're older in your pregnancy, your heart has to work harder. So that puts you more at risk. So there are definitely risk factors that people need to be aware of. I'm just curious, did you ever go back and have the testing done? Would it have been valid if you did it after your pregnancy?
The echocardiogram.
No, the what is the test called? The
BNP.
Yes.
They end up doing a BNP. They did the BNP after I went in for shortness of breath. That's when it ran a BNP, and it was up there. It was sky high. I believe my BNP was 1600. A normal BNP is 100 and below, or below 100. Yeah, and so mine was 600. Yeah, so it was just rising, and it could continue to rise. I know some women it'd be 2,000, 3,000, so it could just going up as their heart is severely damaged. And then it also depends on the severity of the damage. Like mine was able to be reversed, my sister's wasn't, and then also in my case, the medication worked for my body. In my sister's case, the medication did not work for her body. So it's like it's a game of trying to find out what is the actual treatments. They still don't know the cause, but they do think that it's the prolactin that's being released in the breast as the breast milk is forming. They're feeling like it's something that's being released through one of those things, I believe, that provides the milk, and it somehow curves and goes back into the heart. It's very interesting. It's an interesting study that they're doing.
Yeah,
But
I would love to read more on it because it's definitely something I'm very curious about. There
yeah.
was a question in the chat about policy for doing the screening. Now, do you have your own screening or policy or protocol that you utilize for screening, or is there an existing protocol that people could read more about if they'd like to learn more?
Yeah, so we do offer that. It's under our organization with the actual screening that we had came up with. And what it is, it's a questionnaire that we ask the providers that's treating the mother who they're feeling is at risk for PPCM. Like I said, if they have those risk factors that I stated earlier, as in like the preeclampsia, they know, because that's probably one of the most common ones that you would see. So if you know you have a mom that has preeclampsia, that would be a mother that you would more so would probably have screening for.
Okay.
You guys to actually get access to that, you will go on the site. We have actually a pre-recorded course for it, and then we also provide just a workshop for that as well, or just a training for people to kind of get, because first I want to be able to coach you through what it is, why we're asking the certain questions, so the healthcare provider or the birth worker can be familiar with, okay, this is being asked because of this, to kind of connect the dots on why we are asking this certain question and how it can actually save that mother's life, or at least sooner detect a complication, because maybe it's not PPCM, but maybe she was at a cardiac, maybe it was another cardiovascular disease that, probably happened, or maybe, came or approached yourself during pregnancy. How some of those that you will have, and then you
They
don't
reveal
know.
themselves often during pregnancy.
Yeah, so I think having that BNP exam, tests are done to be able to actually see where their levels is at, and then to even know where your levels is at before, probably wanting to become pregnant, or, if you already been pregnant before, kind of just, see, if you could see where your levels is at. If it's 100 and below or under 100, you're good, everything's good. But then also we want to be able to try to see, okay, is it happening? Because with myself, I had prolonged morning sickness, but I didn't get a heart flutter until 36 weeks. So if I got a heart flutter at 36 weeks, well, nothing really happened to my heart by the time that I was, getting ready to be discharged. And, it helped me for those extra few days. It still showed that nothing was wrong with my heart, but when I did get my results, I actually went and got my paperwork this year from the hospital, and it did show that my heart function, I believe it was the systolic heart function, it was decreased already at 45%.
Wow.
But that should have been told to me when she said that, hey, everything was good, it was normal. I should at least been aware that, hey, your systolic is a little bit off, but, something like that. Maybe that probably could have helped, and probably would have got a sooner BNP. But if I would have got a BNP, maybe it kind of would have let her know.
Okay. And so someone else is asking, how early in pregnancy should someone request this test?
So I would say definitely around towards the end of pregnancy. We do have a cardiologist that he's very familiar with this condition, and he suggests that around 36 weeks, a woman should be able to ask for it. Hopefully the obstetrician listens to her and let her, go ahead and just to clear her mind, give her a peace of mind to know that this is not something that she's dealing with, or she's not at risk, or, have any levels that's concerning or anything like that. So I think anything 36 weeks to 6 weeks postpartum.
Okay, that helps. Thank you. And then I just have a question about insurance. I know you said some doctors didn't want to do the testing. Is it because just they don't want to listen, or is it more like insurance won't pay for it unless there are certain risk factors?
With the insurance, I believe some insurances do pay for it. I have read across that some insurances do pay for it. It's just some of the obstetricians, either maybe it could be extra probably to them in their area of work at that time. It just depends on the actual provider, because my obstetrician listened to me. You know, she did, you know, probably if I would have known about a BNP test, I'm pretty sure she would have did that, you know, but she did went above and beyond. She did the echocardiogram, you know, but it still didn't catch what it should have caught. You know, had we probably tested my blood levels first to see, oh, it's something traveling in her blood flow, you know, but it's not, it hasn't revealed itself yet. But let's see after she have this baby. Okay, let's see the next 6 weeks after she done had this baby, you know, so that, but how will we know that I was that risk factor? Well, there wasn't anything that, you know, happened to me.
Right.
Yeah, so the other thing that happened to me was hemorrhaging, prolonged morning sickness, you know, which is why we go back to HG. I wasn't diagnosed with HG, but it was the symptoms that I was having, you know, the prolonged sickness. So that could have been a connection or a reason for her to go ahead and run a BNP just to see, you know, where the levels are at. And I probably would have saw the levels change. Probably would have went from 100 to, oh, it said 5,000, you know, so it's like,
Now, I'm also curious about between you and your sister, because they're such a rare condition, and then to have two in the same family. Did they ever identify any type of genetic connection as to why that happened to both you and your sister?
My cardiologist was shocked at that when he noticed that. He said he never seen it in the same family before, so this was new to him. But he did say that it was a genetic disorder. He said just like cancer. My mom died of breast cancer in 2006, so he was like that was a genetic disorder that she had. She had a rare form of breast cancer, milk duct. So was, yeah, that was a genetic you know, trait that she had. So that's something we had to watch out for as we got older, a genetic trait. Now with the PPCM, it's a genetic trait, something that women don't even know that they might have or to look out for. They do have genetic testing available. So like women are now able to get genetic testing for that. If they, you know, yeah.
Okay. Does anyone else have any questions for Brianna before we let her go? I've shared her information in the chat, so please feel free to connect with her and support her organization. She's doing amazing work. You're in Texas, right?
Yes, ma'am.
Okay. All right. Well, we thank you. I don't see any other questions. We thank you so much for your time. I know I will personally be reaching back out to you as I've said, because we've got some work to do here in Jersey. As I said, we've got number 5 is cardiomyopathy here in New Jersey, and preeclampsia is right with it. So we've definitely got some screening and work we need to do here.
Absolutely. Thank you all so much.
Thank you. Have a great day.
Thank you.
All right, everyone. So we are now at the lunch hour portion of our event. You are free to take lunch on your own. And then you may rejoin. We're going to have the second half of our event will start at 2 o'clock. That is when we will do the section on breastfeeding peer counselors. So you can either hang out here still in the same link, or you can go out and rejoin at 2 o'clock, but we will resume the rest of our day at 2 o'clock. Thank you. All right. Thank you everyone for rejoining us for the second half of our kickoff for Black Maternal Health Week. For this session, we will be talking about the importance of peer support for Black mamas in their breastfeeding, chest feeding, lactation journeys. And so we have joined forces with another Black-led breastfeeding support group in New Jersey, which is Chocolate Milk Cafe. So we have Chris here representing Chocolate Milk Cafe. And then we have a few mamas and a few staff from Perinatal Health Equity who run our groups, who will, I'll do a quick introduction for everyone, and then we will get started with our panel. Let me just make sure that the view is good. Okay, good. All right, so I want to start with our mamas, give them an opportunity to introduce themselves and just tell us a little bit about yourselves and your breastfeeding journey. So Courtney, I would start with you.
All right, well, hello everyone. I am Courtney. I am a mama of two. My youngest is 8 months. My oldest is 2 years old. So I've been breastfeeding for about 2 years and 8 months. I breastfed my 2-year-old until she was about 22 months old, and then my youngest was born. So I had about 2 or 3 weeks off before she jumped right back on. Well, before my new baby jumped on. So it's been quite a journey. I'm loving every minute of it. It's a learning experience. I thought I had it under control with my 2-year-old, but even now with my new baby, Chloe, I'm learning so much more. So, but I'm enjoying it. It's fun. It's a commitment, and it's a journey.
Awesome, thank you.
Problem.
Tamara, I'll give you an opportunity to introduce yourself.
Hello, everyone. My name is Tamara, and I have 2 children. One is 8, and the other one is turning 11. But I breastfed both of them until I breastfed both of them until they were 2 years old. So I love being in this space. I love being in this community, and thank you for having me.
Thank you. So I'm going to go in reverse order from where we were before. I'm going to start with Chris, as Chris is our guest from the outside. Welcome, Chris. Tell us about yourself.
Hi, I'm Chris. I am from Philadelphia. I have 2 children. One is 16. Well, he'll be 16. And the other one is about to be, she just turned 4, actually.
No way.
I know, right? She just turned 4 the other day. I'm so used to hearing her say I'm about to be 4, like I'm used to just repeating it. So I breastfed her for, I don't know, we ended at the pandemic, so time was real warped. But I'm gonna just claim 2 years because it's my narrative, you know what I mean? And my 16-year-old, he loves to say this, I only breastfed him for maybe like 6 days, 6 weeks. Like one of those that it just was so insignificant of an experience that I didn't even know to mark the time. But definitely the 2 differences made me a different mom, a different woman. And just as a person coming in with previous social work experience and social service work, it just made me a different worker and where I wanted to focus my work and what it felt like to be on the other side of the services that I was about to render, so to speak, because I came in as a community member, which is also a humbling experience as a worker, right? And it's like, I need you. So that's how I met Sistahs' face. That's how I met a lot of the faces that I see here today. And now we're Chocolate Milk Cafe. So yeah.
Okay, awesome. Romy.
Hey everyone, so I am the perinatal community health worker and certified breastfeeding specialist for PHEI. I actually breastfed my son for maybe a year and a half. And that's really the reason why I do the work I do right now. I will probably speak a little bit about it later on, but my breastfeeding journey with him just led me to the reason why I decided to go into becoming a certified breastfeeding specialist.
Thank you. Asia.
Hi, everyone. My name is Asia Good. I'm a mother of 2. One is 6 years old and one is 3. So back to what Chris is saying, different mom, different experience. Definitely had opposite experiences breastfeeding both of them. With the oldest, I was in school working, so I didn't really prioritize pumping, but I did breastfeed her for a whole year. And then the second one, I breastfed her, I want to say a little bit before she turned 7 months, but because She ended up getting sick. She was hospitalized, and I didn't realize the stress that she was going through affected my milk supply. So, I'm very passionate about being a certified breastfeeding specialist because there are struggles. As well educated as you can be as a mother and how prepared you are, there's always curveballs.
Exactly. Very true. And Latoya.
Hi, everyone. I'm Latoya McHale. I am a peer breastfeeding counselor for PHEI. I am a mom of two. My son is 9 and my daughter is 8. I breastfed my son, I'm going to say about 4 months. And then I got pregnant with my daughter. My kids are just at a year, maybe earlier than 4 months, but they're a year apart. And I had to stop breastfeeding my son because I had a thin cervix, and they told me that it would cause me to go into preterm labor with my second child, which I ended up going into preterm labor anyway, even though I had to stop breastfeeding him. So my breastfeeding journey was very difficult. Like I said, I breastfed him for not too long, and then he had a milk allergy. He had to go on a bunch of different types of milk because of his allergies. My daughter, she was born almost 2 months early, and her latch wasn't there where it should be. So I ended up just exclusively pumping for her for about a year and a half with her. So like I said, my journey was a lot of valleys and peaks.
Yeah, well, I think we've all had various different experiences. I, like Chris, kind of increased my breastfeeding as I had more children. So baby number 1 got like a day-ish, maybe. No one talked to me about how important it was to breastfeed her. All my family formula fed, so I just thought, whatever, I'll formula feed. My son, I was not able to breastfeed him for as long as I wanted to. I was a staff nurse at the time and could not get my pump breaks. And so as a result, my supply dwindled. So I got him, I think, to 9 months. And then my last baby was my preemie. She was a 34-weeker. And so I exclusively pumped for her for a period of time. And then we moved into direct nursing, and it kills me that it happened, but she had to get 10 mLs of formula because I could not make one of her feedings, but that's all she ever got. So she got that little drop and that was it. But definitely was able to continue for her past the year. So I want to open the floor up to everyone with this question, just as far as peer support and what it means to you and how important is it for Black women? And whoever wants to take it can take it.
I know for myself, being married, my in-laws, they were very versed when it comes to breastfeeding and things like that. But then on my side, they didn't. So it was all about formula. So I kind of had the two worlds, and more stronger was the voices that were saying, you really don't need to do that. Go ahead and give them formula. So just being a part of a community where especially of color, because a lot of it too, it was this stigmatism, like that's a white thing, that's not really a Black thing. And it's really not true, right? But I don't even know where we get that from. But just having that support and not feeling so isolated definitely helped. I even had doctors tell me, go ahead, and your child is not really thriving. They're not really, my son, he was a small little guy. I'm a small person, but the doctor felt that it was because of the breast milk. So they was like, go ahead and give formula. So it was definitely important for me to be a part of this type of group and community.
Thank you for sharing. Our breast milk has been good enough from the start, right? Our breast milk fed this nation. And so we know that that is something we do, that our bodies are capable of doing it. That story has definitely changed our story with how we feel about breastfeeding and lactation, because it wasn't our choice. It wasn't, we didn't have the bodily autonomy. And so that definitely created some separation with the act of breastfeeding because the choice was taken away. But it is something that if we were to trace our native roots, it's what we did. And we did well. Our children did well. The slave masters' babies did well off of our milk. So we know that we got it and we can do it. Who else would like to share about that? Latoya, you can go ahead.
I like just going to piggyback off what you said. I had no one in my family. I had one aunt who breastfed her son for about maybe 2 years. And she was literally the first in my family. And I had a lot of backlash with it, especially when I was told I couldn't breastfeed my son anymore. I was very emotional about it. Like I was crying and I just felt so, I don't know, I just felt guilty about it. And I got mostly from my mom. Me and her have this back and forth about breastfeeding until this day. She's like, oh, it's not that big of a deal. It's not that he'll be all right. People been giving kids formula since the beginning of time. Like, and I just kept saying to her, for me, it's something that I want to do for my child. And if I wish I would have had, even into breastfeeding my daughter, if I would have had some type of a peer counseling space like this, it would have made the situation a lot easier. I had to go to social media to try to get any type of help, with the basics of it, because I seen a lactation consultant in the hospital. I went to WIC. They gave very
Generic.
very generic. Exactly. I didn't get much help on a basis where I can reach out to someone else again or anything like that. So mine was just truly just joining Facebook groups and things like that. But if I had a space like this, it would have made a big difference, that I could just pick up a phone, text or something like that with the situation, because I had none in my family. My aunt, she helped, but she didn't really help. She's like, it just happens. She had an easy breastfeeding story. Her son just took to it. And I didn't have that luxury of my daughter or my son really just doing it naturally. I had a lot of complications along the way that I just had to figure out on my own.
You bring up an important point, Latoya, because so many of us are first generation breastfeeders. We don't have grandma or great grandma on either side to go back to and ask for help. So a lot of us are trying to figure it out on our own. Chris, I see your hand. You want to add something?
I do. I'm real good for forgetting the question, so sometimes I'm gonna just go first. I don't forget. But I do think it's very important. Peer support is it's just the world we live in, right? Like whether you're talking about who's on these social media platforms, that's peer support in one direction or another. You find your space, you find your niche, you find your people. But peer support is just like you check in with your folks, right? Like your peoples. And when you go into these spaces, so I think another thing I wanted to point out for me in particular was the peer support being your peers, like me, like people who look like me, right? And for me, as a social worker, that was like my go-to resources, right? It's like, all right, it got to be something out there, the internet, right? So I hop on, and it was just like, damn, sorry. I'm sorry.
It's okay. We being real, it's all right.
I could tell by the logo, this wasn't for me. You know what I mean? Like I could tell by where the place was, like where the space y'all were meeting at. It is a very intimidating space for me. It is far. It is, you know what I'm saying? I have a new baby and you really sent me way down central New Jersey for a peer support group that were not my peers. Like, should I have attached a photo so y'all could like, so, but with my son, even the part, like it's also just your community and that we're not always going to seek out these spaces, but it's who you put yourself around. Like they're your peoples. And just listening to other people talk, I'm like, dang, like I don't have a testament to say like this person was in my ear not saying don't do this or people ask me where I wanted to have my baby shower. They asked me what I was wearing. Like they asked me, was he going to daycare right away? Just, things. But it was like, I was never, ever asked that question. And then again, just being in the world by that point, it was like, oh, wow, once you put yourself in the space with different people, like, it's like, oh, these are questions. These are, what's your plan? So it literally makes or break your journey. Like, and I see it as a make or break, but it definitely sets the narrative if if that's where you find your support, because we all do. But yeah, that's it.
Thank you, Chris. Romy, go ahead. I'm gonna get to you, Courtney. Sorry.
Okay, no, take your time.
Go ahead, Romy.
So basically to piggyback off of everybody, I think for me too, during my breastfeeding journey, like I had that circle of friends that did breastfeed, right? But when it was my journey, I was the first one to go through certain hurdles, like the clogged ducts that nobody knew about, how to work through them, nobody knew about. And then when searching, I was my peer support was also the internet. I was searching for the answers and trying to work through it. And in my head, I was thinking, how many women are giving up because they can't find the answers?
Right.
And for me, you know, when trying to go to lactation consultants, and again, they don't look like us, it also played a role in, you know, how I was feeling as well. So to have a peer support group and to just hear other moms that say, hey, I was experiencing this, and then them telling how they work through that issue. And I'm like, oh, this will probably work for me. Let me go try this. I would have had more conversations surrounding certain things that would have made me feel comfortable and kind of taken some of that stress away. And I think that's the biggest piece for a lot of our moms that come on the peer support groups, as well as sometimes when you have people that you're connected to, you don't necessarily want to go to them because you're afraid of what they're going to say and what their response will be. So coming to a peer support group where essentially we don't know each other as well as we know who's in our circle, so we feel more open to elaborate on what we're going through. And that's where I think the peer support group essentially helps.
Yeah, I love that, because that's what we're doing in both of our groups, is creating a safe space for moms to feel comfortable with saying what they need to say without feeling like someone's going to judge them or look at them sideways because they're doing this that way. It's always, we might correct something, right? But it's always with love and support, because we genuinely care about the outcome. Go ahead, Courtney.
Well, with me, back when being a first-time mom, I was doing a lot of research. You know how it is as a first-time mom, you're like, what am I going to do in this scenario and so forth. So I was a first-generation breastfeeder, didn't know much about it at all. I just knew I like to kind of go against the grain. A lot of friends and family said that, you know, just make sure your baby eats. And I'm like, well, there's a reason why breastfeeding is a thing. It's a part of my body. So I want to do this myself. I don't want anything that has to do with chemicals or that's just where my mind went to it. And once I put my mind to something, I do it. So I did a lot of research, and then a good friend of mine, she tagged me, or she invited me to the group, and she invited me to several different groups, some which were just, you know, Black, and others which were just breastfeeding in general. And I noticed the difference in those groups. In the general breastfeeding groups, it was a lot of Caucasian women, and it wasn't very much representation of me as a Black woman. So I got knowledge from it, but I couldn't really relate. When I found the Black groups, I saw, oh, wow, there are a lot of women that look like me who's going through this and have experienced issues or getting questions answered. So I felt like just having that network, and just, even if I didn't respond much, just reading through comments, I got so much knowledge in that aspect. And it surprised me. I was really excited about it. And then I think it's Black Breastfeeding Week. Is that in August? My husband, he loves taking pictures. I mean, he loves the whole idea of me being a mother and trying something new. When I did start breastfeeding, he would always take pictures of me while nursing, or just being so happy and free about it. I don't think that you should, well, me personally, I never like to cover my baby. I just wanted her to eat. I mean, I'm cognizant of people around me, but he just got real authentic photos of me, and he posted them during Black Breastfeeding Week, and it went viral. I mean, like, hundreds of thousands of comments, hundreds of shares, or thousands. I think it was like 58.9 shares or 1,000 shares. Wow. And in the comments, there was so much positivity and also so much negativity. Yeah. And it was like, I was a little emotional about it at first, because the negative comments, I'm like, how can people say negative things? Like, this is such a beautiful thing. But from that, my inbox just went crazy with mothers reaching out. I'm asking me, I know you're not a doctor or anything, but can you give me any advice? And I will always start with that disclaimer. I'm not a lactation consultant. I'm not a doctor. This is just my journey and what I do. And I just realized so many women need that support. So now I have become an advocate to inviting women to breast support groups, or, you know, telling them to seek out help, or telling them I'll answer questions if I can. So I just think it's having a peer or someone that looks like you that can relate and can speak, you know, you can speak to those things. It's great.
Awesome. I want to just highlight the photos. It is, you know, for me, when I'm a little bit older than y'all, but when I had my children early, taking photos of yourself was not like the thing. So that is like my biggest regret, is that I don't have a lot of those photos. I have a few, but not as many as I would like to have. And so I would just like to uplift, like, take those pictures. You don't have to post them if you don't want to, but have them as your own sacred memories of that journey that you went on, because you will want them later. Like, there's there's that emotional connection to nursing that, although it's hard when you do it and sometimes you're frustrated, but you miss it at some point. When it's over, you miss it. And to go back and have those memories is important. So like I said, even if you don't share them with anyone else, keep them for your own personal journey. Go ahead, Chris.
I just wanted to say this real quick for real, and it's so important because you literally just said it, like you miss it, right? And another thing about that peer piece, like first of all, somebody in this group is always getting pregnant. I'd be like, come on, they only come and boy or girl, what are y'all trying to do here? So, but it's just like, it's reminiscent and you make connections and you make friendships. Like I literally was new to New Jersey. It was a lot of my first friends that I met that I didn't even realize that that's where it started.
Are like my star story that I share that all the time. That
and it's crazy because
connected through the group.
As soon as this is how I knew, because she cussed at the breastfeeding group. And she jumped, I said, "Oh, she is all right with me." And I walked out in the bottom, and I was like, "It felt so good to hear you cuss in this space," because I didn't know if we was allowed to curse, but I cuss when I talk sometimes. You know what I mean? I could cut it off. But this is like home. Eventually that became home. But the part that you said was like, yeah, you get to miss it, but it's not over. These are still your peers. The thing that connected you guys will always connect y'all. You know what I mean? Like your kid is, I mean, even my kid who didn't breastfeed, I'm still friends with the moms I went to daycare, that they went to the same daycare and aftercare and stuff like that. But the breastfeeding one is just, again, I got two different kids to compare it to. And, nobody wants to compare their kids, but I had two different journeys. Yeah. So much came out of it. And that peer piece for me is just never over. It's how I reconnected with Chocolate Milk Cafe. Everybody in the pandemic, their mental health was messed up. I ghosted some of my friends and I was like, my peoples are still here. Hey, Takesha. But it's definitely a genuinity, and that peer part is very important. That I don't know if I would feel that way forever and ever. Amen. With my obstetrician and my nurse and my labor and delivery, the labor and delivery girl, she was real cool. But like, I don't even follow her on Instagram anymore. So
connection's different. Absolutely. Tamara, go ahead. You're on mute, so.
Sorry, I wanted to also bring up the fact that our kids, well, at least mine, they remember. So my daughter, she's starting to develop. She's an early developer. And she goes, "Mom, are these for feeding?" And I go, "Yeah, they help. They have milk in there." She goes, "Oh, so wait a minute. When I get pregnant and milk is gonna come in there and then I can feed my child." And I go, "Yeah." So just imagine that we are doing something, we're passing down from generation to generation. So when we feel as though we didn't have that support, our kids, they'll have that support.
Right. And they recognize what we're doing, like whether it's your professional journey, whether you're providing it for your children, they observe you, they observe everything that they're doing, and they watch you, and they do take those things in. So we're definitely leading by example. This question is for the peer counselors. We've talked about kind of the importance of the peer support, but let's help define, like, what does a peer counselor do? So if someone's seeking out support, what can they expect from having a peer counselor?
I guess I'll answer. So initial contact could vary. So lucky enough at where we're at Perinatal Health Equity Initiative, we have Facebook as an easier access, you could say. So as soon as you join the group, you'll get a welcome message in your DM. So immediately. And then you're given the links to whether you're going to submit a report request later, or just ask questions, or even ask the group questions. And it could just, it could be a comment that leads to, hey, maybe you should connect with a breastfeeding specialist. Here's Asia, here's Romy, here's Latoya. So there's that way through Facebook, or through email, or through a phone call. And sometimes the situations are more severe than others. Some things can be handled through the phone. Some things could be handled virtually through Zoom or in-person consultation. So it just depends on where the mothers are. We just meet them where they need, like whether it be, okay, I'm going back to work. Okay, we have a pump plan. Let's get this ready. Oh, I am breastfeeding my toddler, but I just had my newborn. What to do? Okay, let's do this. So it just depends. Whatever the mom needs, we meet them exactly where they need to be met. And it's not like we push the whole, you need to only breastfeed. We'll meet you exactly where you are, whether you're exclusively pumping, mixed feeding, exclusively breastfeeding. weaning, introducing solids. It just depends.
Thank you.
And just to continue off of that as well, like we have the luxury of having Nastasha as our IBCLC. So whenever you guys come to us, we always deal with issues that are within our scope. But if it's something like, for example, if it's a tongue tie where it's out of our scope, we can always direct you to Nastasha, who is able to have an in-person consult, or if we have another IBCLC in the future where we can direct you to that IBCLC. And in addition to being a peer counselor, we do offer our peer support groups, which we're talking about now, where we always invite you to come, whether you are still breastfeeding or not. So this kind of speaks to what Chris was saying about having that connection continue, because a lot of our moms still come on the breastfeeding support groups even after their breastfeeding journeys have ended. And we encourage that, because you coming on as a mother who has had their breastfeeding journey already, you're able to help the new moms as well. And that conversation continues. So that's a little bit of a sum of what we do day to day.
Mm-hmm. Yeah, I just want to add that piece about those who aren't breastfeeding anymore, right? We've talked, and we saw this especially during COVID. We've lost our village. Like, we don't have one. So many people relocated to different states. They don't have family. It takes a village to raise a child. And sometimes it is just making a connection with someone who is your new friend. And if you need a babysitter, if you need to vent to somebody because you don't have anyone else to talk to, creating those connections is super important. So we definitely don't want people to drop off after they're done nursing. We want that relationship to continue, because you need people, you need your people. Chris, you look like you were about to say something.
They should really move the mute button to the bottom. Like, I feel like so at Chocolate Milk Cafe, it took me a minute to interpret the question for us, because we're facilitators. And so it's pretty much translates to the same thing. But one thing about it is it's not just mother centered, and it's not just breastfeeding centered, but it's family centered. And that was I was just up in there by myself, you know what I'm saying? But it was nice to see the dads have a space for other partners and dads and things come in. And it pretty much looks a lot like, peer support and facilitation. But to me, that was a very unique about Chocolate Milk Cafe. And it also created, and not to jump ahead, but it created some challenges, but eye-opener challenges that it's a shame, but Black folks is trying to catch up in this area, you know what I mean? And we're just catch up in presence. But when that translates to all the things that we now have to consider are modern day things. So even the language that we use, the people we're including, that, you know what I mean? It might look different for just this is a sacred space for mommies. That's cool for a little white mom group, you know what I'm saying? But we got to start at getting the families back together. We have to start at the breastfeeding work is about community work. It's really, in my opinion, Black maternal health work is the beginning of all of that community work. We just have to take better care of our moms and babies and teach our family members how to do the same. So we've had grandparents come to our groups. We've had, like I said, partners who just, we all know that looks very different to just use the term partners. Right. And still respecting the sacred space that we're trying to create with maintaining that this is a space for folks that have the Black experience, live the Black experience. And again, being a part of both groups, I've seen the challenges that creates. But yeah, that's all I wanted to say.
Okay, thank you. So anyone can answer this, because we've all breastfed at some point in our lives. But what would you say, joining a group, what value did that add to you personally as a Black woman nursing? What was your motivation for joining a group in the first place?
Hey. So again, my motivation in the beginning, honestly, was help. It was a humbling, helpful experience. And I just wanted to be on the other side. So I honestly, hearing you guys speak after we did introductions, I always know I'm going to go first, even when I don't forget the question. And then when everybody talks, I'd be like, dang, I should have said this, this, and this. A lot of times I forget my credentials, and trying to shape my bio, I forget my credentials, and I'm trying to figure out how to word it without giving all this credit to these institutions that honestly did not make me. So they made me credentified or whatever to these people. But when I open my mouth, like, I'm a Black woman and I'm coming from these Black spaces, and that's the experience. And like, it just so happens. So being in this peer space was like, it felt so good that none of that stuff mattered. You know what I mean? Like, I was in there with somebody who I know just because they said I'm a this, like what their tax record was, but we're in there with the same journey, you know, like the same journey has brought us together.
Mhm.
And that was a huge part that that when I open my mouth now and I say that I'm this because I did this, like I put the work in, I did the time, I breastfed, I fell off, I did this. I don't need to say no college. I don't, you know what I mean? I name drop out of proudness. Like oh, Nastasia, oh, this is a breastfeed, chocolate milk cafe. Like, you know, like the names and the credentials beside it is really out of my pure, like authentic excitement to be connected to these women out here that is doing this work and watching the work grow so much. But that peer community space, I'm listening to this lady because of what she went through. Like I'm listening to this sister, and it doesn't really matter that she's not done her IBCLC, you know what I mean? Like
Right.
training, like she cried for 4 hours with the clogged duct. That's enough experience for me. But so that's really a lot of that has to do with me rejoining those spaces and appreciating them so much. It's like, it really does not matter. It's added, you know, but it doesn't matter.
Right. Thank you. Tamara, go ahead.
For me, it's 2 words: to be seen and to be heard. There were times when in the middle of the night, I'm crying because I'm like, can I really continue this? Can I really continue to go through this? And it was when I looked in the chat groups and I scrolled up and, oh my gosh, I realized somebody else put up that they were anxious and they had anxiety. Because to be honest, not all family members, even though they have the experience, they may not be as transparent with you about how they really felt. They didn't feel like doing it all the time. So just to be seen and be heard felt really good.
Yeah, and to that point, like when you are going through something that's hard for you and no one else understands how hard it is, they don't want to keep, like, they'll support you, right? They will do their best to support you, but they don't want to keep hearing your stories of just your struggle. And somebody who's going through it gets it. They understand how many times you need to say X, Y, and Z is happening to you and be validated that those are like real feelings, because you feel silly sometimes, like crying out of nowhere, spilled milk. I remember the first time I knocked over my milk and literally cried. And I know many of us have been there. That looks crazy to people who don't understand how long it took to pump that milk out and to watch it spill on the counter. That is nuts. But you need people who understand you. And so thank you for validating that the additional space of being able to say what you need to say and be heard is important. Latoya, I want to get to you. Go ahead.
I was going to say exactly what Tamara said. I felt alone in my journey, especially the second time around, I guess, because, again, like I said, I had no one to tell me anything. And so I sought out a space so I'm like, I can't be the only one going through this. I can't be this alone and this bewildered about this situation. I need someone to say, hey, you are not alone. I've been there, I've experienced it, and you're going to get through it. And that was my main motivation for getting on social media and looking for just where I could just type up something like, hey, my daughter won't latch today, or my latch hurts, or whatever the issue was, and someone was going to respond to it. Just that space of being alone, it got me to the point where I was about to give up because I did not have it in my personal life. So once I logged on and found, breastfeeding groups, it made the situation a lot easier. It absolutely turned it around for me. I was more determined to keep nursing her. And even when I stopped nursing her, I just started exclusively pumping. Even people tell me, you're still breastfeeding, you're still doing what you need to do, made a difference, because even with that, I started to feel, again, guilty, like she's not latching, this isn't working, she's just gonna have to get formula. And people were like, no, you can do this, that's still breastfeeding. And it gave me the confidence to keep going. So that made a whole world of a difference.
I'm going to say it again, just so people understand, exclusive pumping, any type of pumping, is nursing. It is work. It is hard. You are still providing your babies human milk. And if that's your journey, that's your journey. Don't let other people deter you from it, tell you can't do it, that it's too hard, it's not sustainable. I myself did it. I know many other women who have done it and been successful. So if that's your choice, like the act of nursing is not for everyone, right? But if you feel more comfortable with putting the baby or pumping to give your baby your milk, that is absolutely okay. Courtney, go ahead.
I'll be really quick. My motivator was just for information, for like hacks or best ways to do different things, just being able to read different scenarios and better prepare myself. It was just there for me. So that's basically it. I was motivated to learn more, to see more, to read about people's experiences, just in case I came across that experience. I'm like, okay, someone else has been through this. I don't have to ring the alarm running to the doctors or anything. And in addition to that, my lactation specialist at the time, she was a white woman. She didn't seem supportive. So I said, you know what, I'm just gonna seek my own information and help. So that definitely motivated me.
Yeah, I hate that this is so many of our stories, is that we went to get help from somewhere and didn't get it. I mean, it led us to where we are, right? But it all was rooted in not getting the support we needed when we needed it from the people who were supposed to provide it. And that's unfortunate. And so I do want to highlight that as well, that if you are not getting supported by your providers, which is not uncommon for Black women are 9 times more likely to be offered formula than anyone else. And that includes baby-friendly hospitals. So even hospitals that are designed to protect breastfeeding don't always do so for Black women. And so if you feel like you're being made to feel less than, or your providers are not listening, or no one's talking to you about breastfeeding, do your own research. We have a team of people here, both groups, Chocolate Milk Cafe and Sistahs Who Breastfeed, who are willing to help you through it. But don't feel like because your providers are not supporting you that your journey is not worth it, or that you shouldn't continue with it, because it absolutely is. Chris, did you want to say something? Your face looked like you wanted to say something. No.
Girl, the last part of what you said was really like want, because I just remember when I met you and I had drove all the way down to South Jersey and I was crying on that white woman's shoulder. Like, and I wonder if she thinks about me. And that's not how I want to be thought of. Like, it was like, and another thing with Chocolate Milk Cafe, was bigger than breastfeeding. In that moment, I know I had a 6-day-old baby and I'm driving 18 exits on the turnpike, whatever. But it was it was other stuff. It was home life. It was adjusting. It was my body. It was just so much that I knew I could not tell that lady who couldn't even pronounce me or my baby's name. Like, and like, I'm so serious. Like when I got the name, like when I got your name, I was like, it's so many S's in here. Like, this is home. Like, this is like, all you was missing was a random apostrophe. Like, and I would have been like, sis, like, I was so glad to be, and it was like where we started, and we treated me like a person. And then I found it wasn't exclusive to this nice young lady. Like, it's a world. Like, then I met Takesha. It was a world of people. And then, like I was saying, with peer people, it wasn't just the people. It was, people underneath it. It was just, it was just a lot. But that I will always remember. Like, damn, just like I tell that story about that lady. Like, like when this Black girl come and do that, lady remember me, because I remember she said something and I was just like, I just gotta go. Like, it was the most, I just got no business here. I got to go, and I left. And I'm like, she still doesn't even know why I came. Or maybe she figured it out. A lot of work has been done in New Jersey that I'm sure she's called Lida. That was like, that Black girl probably wasn't comfortable. I wasn't.
I will say a lot of work is happening, right? And I don't know if always the right people are hearing it. This is outside of, even what we're supposed to be talking about, but so much of what we do and what we talk about, it's always the same people that show up for it because we deeply care about it. Any meeting I go to, if it's about breastfeeding, I could tell you who's going to be there because we all care about the same stuff. But the people that need to hear the stuff don't come to the meeting. They're not on this webinar. They're not listening. And that's where we need to figure out how to break that down, because they don't, somebody told this to me with my students, right? I had made a general statement about respect. And so my boss said, if you don't call it out specifically, they think you're just saying in general. You're not talking specifically about them because you didn't say, hey, Tanya, I'm having an issue with you doing blah, blah, blah. So when we say racism exists, when we say implicit bias, unless you say like, hey, it's you also, people don't think you're talking about them. And so they don't show up to these things because I'm not racist. I don't do these things. I treat everyone equally. They don't acknowledge that it's part of their care package. And that's, you know, where I'm still struggling to try to break that down. We host these events and we try to bring awareness, but the people that need to be here often aren't. And that's, you know, that makes me sad. Moving on, let's talk about successes. What has been a win for you in your breastfeeding journey as a Black woman, or just as a woman breastfeeding? What would you say has been a win for you?
There we go.
Yeah, go ahead.
Okay, a win for me was that you know, I was a younger mother. At the time when I first started breastfeeding my daughter, the only reference I had was my mother breastfed me for a little bit. What is a little bit to her? I didn't have no clue, but I know with my self-determination was I'm gonna breastfeed her for a year because I learned that she needs to be breastfed to a year. And then now, as in a professional setting, I could have went past a year because breastfeeding with her was easy. There was no reason to stop her, but I thought she just needed a year and she'll be good. So my own self was like, you got to do a year. You got to do a year. You're going to just keep on going. And I didn't really have anyone to talk about with breastfeeding or parenthood in general because I have my partner, but like we have each other, but where's our village? Where's everyone that said, oh, congratulations. Oh, what do you need for the baby shower? Oh, what are you going to do when the baby comes? All those things that I needed wasn't there. So myself and him, we're just like, this is what we're gonna do. And I mean, I felt like he could have been a little bit more involved, but that's also my fault. You know, being that I know the stuff now, if I could go back and say, hey girl, this is what you need to do, this is what you need to let your partner do.
Yeah.
Breastfeeding could have been a lot better than what it was.
Excellent point. Excellent point. Courtney, go ahead.
Yes, very, very similar scenario as Asia. My goal with my first Callie, I said, I'm going to breastfeed for a year. That was that target marker that I saw in groups or that I heard people talk about. And when I got to a year, I was like, why stop? I'm already in a swing of things. I know what I'm doing. At that point, it was easy. So the year passed and then she she was about to turn 2 and she weaned herself. If she didn't wean herself, I would have kept going. And that's the scenario with my youngest now. I'm just going to go until they wean themselves. And I did have, and currently still do have the support from my husband because he's like, we are not buying milk or breast milk or formula. This is the cheaper version. Right. Do what you need to do, pull those boobies out and feed the baby. So just having the support from him and just the, you know, being able to continue going. I just feel like any day that you wake up and you're able to nurse or pump or whatever it is to give your baby human milk, I think that's a success. So I'm just happy. I'm happy with that.
Thank you. Mm-hmm. Chris, go ahead.
So definitely like the milestone, I was using those things as markers, time milestones and everything. So just on like a little more transparent note, I think that I gave my daughter an identity that as a woman and a potential Black mom that I did not have, that may have set why I approach motherhood and breastfeeding and other things. There's a funny story, and I'm not quite sure if my friend is on here, so I'm not going to say her name, but we had a moment where she told me she was breastfed, and then she came back and told me she wasn't breastfed. And I remember joking. It was a joke. I'm a clown. You know what I mean? Like, we were clowning. And then I was like, dang, like, I knew I wasn't. I'm adopted. My narrative is just very, you know, I was solid in that though, but I didn't know how serious that could have been. And then it actually was, you know, in the moment that she told me it wasn't, so I got to make light of it. But it was like, dang, I never, you know, I went my life, like someone else was saying, we didn't know the time. It was just whether or not you were breastfed or formula fed. But in that joke, it was like, wow, as a Black mother and my daughter who is potentially going to be a Black mother, I gave her like a transferable, you know, beginning narrative. That's just not one that's placed around, I was born at this time of day in this hospital via C-section. And honestly, our our birth plan did not go as planned. So to me, it was very important that I kept up my deal, my end of the deal, you know what I mean? In the sense that I could control, because I was like, hey, little girl, like you were supposed to be born in the water. You're supposed to be born, like you didn't keep up your end of the deal. Like you were slipping and doing all this. And I ended up having to have a C-section, and that was like restorative. You know what I mean? Like had I made it, it was like this part I could do. So that's the success in it for me, in addition to the time that, I just claimed because of the pandemic. So yeah.
Great, thank you. Latoya, I saw your hand next, go ahead.
My success story, it's more of like with me and my sister, being as though my sister had her first child way before I had my first child. It was like 3 years before I had my first child. And she breastfed him. She had an okay time. And then we were both pregnant with our second kid at the same time. We were actually our due dates were days apart. And she was like, I'm not gonna breastfeed this one. And I was like, why not? You did it with the first one, why not? She was like, I can't commit to it this time. And I'm like, we got each other. Like you got me, I got you. Let's just do it together. And she was still, I ended up having my daughter a few weeks before she had her son. And when I started breastfeeding her, she was like, okay, I'm with it now. Like, okay, we're going to do this together. And she has had 2 subsequent babies since I had my second one. She's breastfed both of them. Like her 2-year-old was breastfed literally until the week that she gave birth to the new baby. And now she's kind of like tandem breastfeeding them. She had stopped breastfeeding the 2-year-old when the new baby was born. Now she's like kind of going back and forth. And I feel like she's my success story more than I am myself, because we had nothing to, like I said, to go on. We've like really been like really each other's champion, and me more now towards her because she's still currently breastfeeding, 2 babies. So I feel like just my support of her support of me is just our success story.
Yeah. I'm going to say something. When I first got into lactation, I used to feel like a saleswoman, like I was selling breastfeeding to people. Like I worked in a hospital in the Bronx that was mostly Black, and they weren't interested. Even me coming in the room as a Black woman, they didn't want to hear what I had to say. They were not interested. And it used to break my heart every day. And I used to be so upset. And I was talking to my mentor, and she would tell me like, it might not be this generation, right? But you're still planting the seeds. And that's what I can see all of us have done in some way, is we have planted a seed for the next group. And so while we may not be directly impacting the people that we think we should be or thought we would be, we're still out here planting those seeds for the next generation to do it. So I want to give everyone a round of applause on that, because these numbers will change eventually. The work that we are all doing is eventually going to put our breastfeeding rates where they're supposed to be. I have hope that we will no longer carry that title of being the lowest group of breastfeeding women. I feel like that will change eventually. I don't know who I saw first, Courtney or Romy, whoever wants to go.
I'll go.
I spoke already. I'll lower the hand. I'm sorry.
Oh, okay.
It wasn't a new question.
Okay.
So a huge win for me, and this kind of goes with what Chris was saying. I also was a C-section mom. I feel like I went through labor in every way possible, but breastfeeding for me was the one thing that I was like, okay, I could do this. So that was big for me. And I'll never forget this, but this is why I tell people to just have that one call person that you can just call on when you feel like you're breaking down and you need that encouragement. Because I remember meeting with my pediatrician and him telling me that I may have to supplement with formula because my son wasn't growing on, like he wasn't hitting the curve the way he should have been. He was still healthy, he was still gaining weight, but he felt he had a little bit of a dip. So he set up a 2-week weight check appointment. And I remember calling my cousin in complete tears, telling her, this was the one thing I knew I could do. And he's telling me I have to supplement with formula. And I remember her telling me, like, you're doing all the things you're supposed to be doing. You've been doing phenomenal thus far. He's still healthy. He's still gaining weight. You don't have to listen to him. Just do what you got to do. And it's like something automatically clicked. Like I just continued to do what I had to do. I continued to breastfeed. I pumped in addition for those 2 weeks. I still had milk in the fridge because I thought I was making enough. I topped off when I needed to top off. And I remember going, and I tell this story all the time, I remember going back to the pediatrician and him saying, "Oh, you still have milk in the fridge?" I'm like, "Yeah." And he said, "Oh, well, maybe he's just growing a little bit slower. Maybe that's just him." So in my head, I was like, if I would have added the formula at that point and didn't just follow my intuition as to know that my son is okay, he's gaining weight appropriately, he should be healthy, he's fine. I would have supplemented with the formula and I would have never known what could have been. Like I would have never known that I would have been able to carry my breastfeeding journey over a year with my son, because I did have that marker for a year, but Carol had other plans, but I was able to do it. So for me, that was the biggest win, and I'll probably never forget that.
Yeah, I want to just highlight that formula is not the solution for breastfeeding issues. It often becomes the default anytime you come in. And sometimes these are not even problems. Like what was going on with your baby, Romy? I wonder what growth chart they were using, because often the wrong one is being used. We're measuring babies against the wrong standard. We're not using breastfeeding as the basis for how babies are supposed to grow. And we create fear in these mamas for absolutely no reason and make them doubt themselves. And often they're doing everything they're supposed to be doing. And then to be doing all of that and then still be told you're still not doing it right, that's defeating. That really makes you feel low. And we've got to do better with that as providers. And I can speak as a nurse. We as providers have to do better than that. We have to educate ourselves. We have to be better for our families. So we are at 2:56. I want to give everyone an opportunity to share any closing thoughts that they might have. I'm going to just check the chat and see if there are any questions that anyone had. What self-discoveries has your breastfeeding journey led you to? I think we'll end with that question. Go ahead, Tamara. Oh, you're on mute again.
Sorry, really quickly, I would just say resilience. When you can breastfeed and cook at the same time,
hey,
you have it.
Baby wearing for the win.
I have to say breastfeeding is like a multitasker thing. Like literally, if you could breastfeed, pump, or whatever, you are A1 at multitasking. Even like, someone who's assisting someone pumping and all that, that's just like another, like, it's like it should be in a comic book.
As self-discovery is really big for me with regard to my breastfeeding journey and just motherhood. I honestly found myself, like, not to be all whatever, like I couldn't break it down. I sat here, I heard words, and I'm like, it was really true. A community was important, peer support, and introducing it to my family. And at the end of the day, it was just me and that baby, you know what I mean? Yeah. That, like, I knew I had the tribe behind me. I knew that was the difference. I knew I had this on the side. I was way more educated. But I just found pieces of myself that honestly, some things I prided myself in never even be like, oh, I'm not that, not that I'm not disciplined, but it was like, I didn't try at anything, a lot of things. I just don't have to, not to be like that, but some things I just don't have to try at. When you know you're naturally good at this, you stay in your lane of things. Mm-hmm. And this was a thing that was like, I'm supposed to be good at it, or at bare minimum sufficient, like getting the job done. And I walked in that confidence. Someone used the word intuitive. It made me walk in my own, it made me challenge the very things that I set before and said, I want to be this way or not this way. And even with regards to rights and social justice around it, once I kind of got a little, I got my stuff together and I could do those things, it guided the work that I did. It redefined, even in different spaces when it wasn't about breastfeeding, I had that in my head. I've had Black maternal health in my head, that in this space, like, I got to get out. I have to remove this from my space because my values have been redefined by this journey. And we all don't have to be doing it, but it's just something I can or cannot do. So it was really interesting to me how, you know, breastfeeding just spilled over into so many different like facets of my life.
Yeah.
And redefined it in a good way. So
that's beautiful. Thank you, Chris.
Thank you.
I want to echo that, because like, you know, if you have more than one child, like I feel like Danica got the best version of me. And because of where I was at the age that I had her, the level of understanding that I had, and I know you're not supposed to live in regret, but there are definitely times when I look back at what it was like with my first child and what it was like with my second child, and wish that I knew the things that I knew when I had my third, and how I would have parented them so differently from inception, from even, you know, what you said, Chris, about not trying things. I wish I would have known about a home birth or a water birth, or even thought like those were things that I could do. I was programmed that you deliver in a hospital and you have an epidural and labor's too hard, so don't do it. Like, I really wish that I would have tried. And so I guess if that's my one thing that I would say is to, you know, you can do hard things. Don't give yourself up on your ability to do those things. Latoya, go ahead.
I basically was going to say the same thing. It made me realize I was stronger than I ever gave myself credit for being. I never, like, prior to becoming a mom, I just was existing. And then once I had my kids and had them a year apart, that in itself is, I could write a book another day. But having a 1-year-old and newborn, it was just, I look back at it now, at them being 8 and 9, like, how did I make it? Like, seriously, it was just, and all that, everything was a culmination of me finding my own strength as a person, as a mom, breastfeeding, difficult births, difficult pregnancy, everything. I was able to give myself some strength. Like, girl, you got it. You okay. You can handle a lot because you've been through that.
Absolutely. Thank you.
I'll go. So for me, I feel, and I say this all the time, I feel like my breastfeeding journey just brought me like right back to the feet of my purpose and my passion, because ultimately I knew that I had to make my way back to doula work and serving mamas, but I didn't know that breastfeeding would trigger something bigger in me and cause me to want to provide a bigger impact. And now to have mamas be able to feel empowered after seeing my journey, or even just have my mom, who was encouraging me to just, you know, give water to the baby all the time. So now seeing me have breastfed and to know that, oh, you did an amazing job, and to hear that from your mother as well, who is kind of like your experience. We're teaching our past generations as well. So I think that is so huge for me, because to know that I've educated my mother by just my experience alone is one of the biggest things that I could have ever asked for as well.
Beautiful, Roma. Thank you. Anyone else have any closing thoughts?
I have one more thing to say. I just want to say, all of us, whether how different our breastfeeding journey was, the common thing was we did change the people around us. So it might not be on a greater scale like we would like to see, but our sphere of influence normalized breastfeeding because of our part in this whole journey.
Absolutely. Chris, you wanted to add something?
I did. It's real quick, but it's serious, but it might come out joking, but it's really, really serious. So it really redefined my physical body. Like, I'm about to change my camera to show y'all, but I was never like confident in like my breast, and I just felt like I wasn't womanly enough because I didn't look. And that was another thing of going into these spaces of Who's Breastfeeding, like all these like big breast women, you know what I mean? And it really, like, you can't tell me anything. I'm having them out, like, you know what I'm saying? I'm taking over because you don't know what I have done. You know, they've changed size, they've changed colors, they've changed. We had to reintroduce ourselves to one another, and that's a part of womanhood. So that was in all seriousness, it really gave me, like, redefined my own body image of myself, not through physical, you know what I mean, beauty, but like work, like they work, they did what they were supposed to do, no matter what
That's
size.
amazing. Absolutely amazing. And I'll highlight that breast size is not a determinant factor in your ability to breastfeed. Many people think that you don't have to be a double D cup to have a successful breastfeeding journey. You can breastfeed with any size breast for the most part. And if there are issues, that's why IBCLCs exist. If you're finding like things are not working for you the way you thought they were, then you go and get, you know, the support that you need to help figure out those things. But you know, there is a specialty in lactation. And I'll just highlight this because this is my soapbox. The pediatrician is not the expert on lactation. Your OB is not the expert on lactation. There is an entire specialty dedicated to how the breast works and how it operates. Find those people. If you have concerns about breastfeeding, those are the people you want to go ask. There are definitely some pediatricians, midwives, OBs who know their stuff, right? But I'll say in my experience, I don't meet as many of those. I usually meet those who are undermining and giving wrong information and outdated information. And so ask those questions, find out, you know, where your resources are and go to those people. With that, I will close us out. I want to thank our panelists so much. Every time we do these panels, I'm always so impressed with the level of content that comes from them. I always have my list of questions and things I want to ask, but there's always so much richness that's added that we don't even stay on script most of the time. All of you added amazing feedback, journeys, stories on lactation that I hope our community finds valuable. This recording will be available after. So with that, we'll conclude day one of Black Maternal Health Week. Tomorrow is day 2. We have Policy Day. So if you were interested in learning about policy and how it impacts Black maternal health, please tune in for that. We will have Senator Ruiz kicking us off, as well as Assemblywoman McKnight, who will be talking about different policies in New Jersey. We have our Policy 101, which will give you an intro to what policy is and why you should care about it. And then we also have the NJ Doula Collective. It's a new initiative that's here, funded by the state. Health Connect One, which is an amazing organization, will be running that doula collective. So if you'd like to learn what it is and what they do and how to bill as a doula to get access to Medicaid benefits, that's a session you want to attend. Again, everything is free to you as a part of our sponsors. We were sponsored by Robert Wood Johnson Foundation and the March of Dimes. So we hope that you'll tune in and join us tomorrow for our next event. Thank you all so much. Bye.